Can we agree this? You accept, do you not, Ms. Whatley's assertions that there was systemic racism in the NHS? That's correct. We can agree that, yes?
Yes, and I'd in fact addressed exactly this question even before the pandemic, given a speech on it, referred to it in 2019, and there was this internal report into racist behaviour in NHS BT that was published on the 9th of June, so the day before this exchange started.
So we've got that response in mind and what you said earlier today, but let me ask you this. And I've seen that you flagged it to number 10 and Ms. Badenoch.
Yeah.
But let me ask you this. Did you or Ms. Whatley take any further steps regarding the recognition of ethnicity as a risk factor, aside from flagging it to number 10? And if not, why not?
Yes, well, so she flagged it to Ed Argar, who's another minister in the department responsible for the NHS, whereas Helen Whately was the minister responsible for social care, and number 10. She also had responsibility for the NHS workforce, hence her interest in this area. Yes, what happened was that this is just before the Badenoch review is announced. So what happened was that in order to strengthen the response in this area, the Department for Equalities was essentially brought in to do this. Okay.
Was it raised within senior personnel within the NHS, for example, as a guidance or as a reminder?
Yes, especially in the context of the NHS BT report, which was an important report and needed action to respond to. I mean, this was something I really care about and took the action that was necessary. And you can see by my immediate reaction within 10 minutes, yes, agree 100%.
All right, let me move on to my last questions. I've got two more last questions. I want to get them done very quickly. It's alleged that a chapter was removed from the Public Health England report on disparate impact on Black, Asian and minority ethnic groups prior to publication. And media reports at the time suggest that this was at your office's request. One such article states, quote, one source with the knowledge of the review said the section did not survive contact Matt Hancock's office over the weekend. And if you need the reference is INQ 000308410. I'm not asking that it be called up, that's just the reference.
Yeah.
Exclusive government censored Black, Asian, minority ethnic COVID risk reviews news health service journal.
Yeah.
Question, can you explain the circumstances surrounding this paragraph's removal?
I don't know whether a paragraph was removed or not. I can't recall that. But I do recall there being a public discussion along the lines that is suggested by the HSJ report. I saw Minister Badenoch's testimony to this inquiry, and I agree entirely with what she said. I accept that the decision to change the report into two reports, one essentially reporting the evidence that had been put forward, and another essentially a statistical and scientific report. I accept that caused a distrust in the process. Honestly, my response to the paperwork that you've suggested, which you mentioned, which I've read, is that if that happened, and I'm not aware of whether I had any engagement with it at that time, it says Matt Hancock's office, it may have been that this was the beginning of the separation of this report into two separate reports, and I concur with what Kemi Badenoch said.
Right, Ms. Hancock, let me ask you my last question. Can we agree on this, Mr. Hancock? That on reflection, the UK's government was not as well prepared and equipped to deal with the challenges of the pandemic that were experienced by Black, Asian and minority ethnic healthcare workers. That is, the disproportionate death rates and worse adverse health outcomes. Can we agree on that?
Well, I think that's true. It's also true of the response in terms of everybody. And I think that the lessons that we're learning here, specifically in terms of disparities and the impact, disproportionate impact on people from ethnic minority backgrounds, is a very important part of the lessons that we need to learn for the future.
I think we're agreed.
I think we've agreed on almost everything.
I think we have. Thank you.
Thank you, Mr. Thomas.